and I shall kindly ask everybody to please put your phones in silent or vibration to avoid distraction during the press briefing. At this point, I shall implore all of us to invoke the presence of God by offering our silent individual prayers. Amen. Amen. Let me, on behalf of the Honorable Minister, the Deputy Honorable Minister, welcome you to the weekly National Press Briefing of the Ministry of Information, your one-stop hub for diverse and credible news. At this point, before I call upon the Deputy Minister, I would like to encourage members of the Fourth Estate to please bring forward your recorders before we commence. On that note, if all the recorders are here, I would like to call upon the Deputy Minister of Information and Communications, Mr. Solomon Jamiu, for the weekly update.
Thank you so much. Ladies and gentlemen, it's a pleasure to have with us the Honorable Deputy Minister to Ministry of Finance, who is the Chair of the National COVID-19 Emergency Response Center, Honorable Sheku Bangura. We also have with us Professor Fode Sarr, the Vice Chancellor of the University of Sierra Leone, and who is the Technical Coordinator for the response, National COVID-19 Emergency Response. Next to him, we have Group Captain Kumba, Hassan Kumba, who is the head of the operations pillar, NACOVAC. And then seated next to him, we have Dr. Franklin Bendu, who is the technical advisor to the NACOVAC chair. On this side, we have Harold Thomas, who is the risk communication expert and in the response and the health education manager in the Ministry of Health and Sanitation. And next to him, we have Dr. Tom Sise, who is the program manager for child health and EPI. So our friends are here to, and the pillar lead for vaccination in the response, born out of the fact that it's good to integrate, it's good to see synergy, and it's good to see seamless operations in the response. And the fact is that the response continues to work closely with the Ministry of Health and Sanitation. So I'll just give us a few briefs before I would give the floor to the eminent personalities with us. First is that it has pleased the government of Sierra Leone to announce the ban on importation of timber for the period 1st June 2021 and 31st October 2021. So there is now a ban, and it's announced now a ban on transportation of timber for the period 1st June 2021 and 31st October 2021. His Excellency Dr. Julius Maada Bio has opened the 4th session of the 5th Parliament of the Second Republic of Sierra Leone. The President, in his statement to Parliament, highlighted key achievements of his government, including human capital development, COVID-19 and healthcare facilities, agriculture and food security, repeal of the obnoxious criminal libel law, etc. The President further affirmed the right to education with a policy of radical inclusion that has irreversibly overturned the ban on pregnant girls, championed menstruation health, campaigned nationwide against early child marriage, and provided some support for students with disabilities. Human capital development is not a slogan, it is inclusive. It is the key to achieving sustainable development with our own human resources, using homegrown solutions, empowering our local communities, and enabling innovation, creativity, and technology to bridge the development gap. Secondly, Sierra Leone's Minister of Foreign Affairs and International Cooperation, Professor David J. Francis, together with his counterpart, Sergei Lavrov, the esteemed Minister of Foreign Affairs of the Russian Federation, have signed a memorandum of understanding for a visa-free movement of holders of both diplomatic and service passports to facilitate the movement of people between the two countries. Signing on behalf of the government of Sierra Leone, Professor Francis appealed to H.E. Lavrov, his counterpart, to consider reopening their embassy in Sierra Leone to facilitate the movement of people between the two countries. Next, ladies and gentlemen, the Office of the Attorney General and Ministry of Justice has on Friday, 14th May 2021, held a day's retreat for the review of the Sexual Offences Act 2012 and its amendment of 2019 at the Occasions Resource Center at Lakar. In his opening statement, the Attorney General and Minister of Justice, Anthony Brewer, said violence against women and girls from previous survey indicates that 1 in 3 women worldwide experience physical or sexual violence by an intimate partner. The minister said that after consultations and advocacies by local and international organizations in 2012, the Sexual Offences Act was enacted to serve as a landmark piece of legislation to combat sexual offenses, provide support to victims, and hold perpetrators accountable. Next, the First Lady of the Republic of Sierra Leone, Madam Fatima Bill, has launched the 2022 Budapest Bamako Freetown Rally at a cocktail organized by the Ministry of Tourism and Cultural Affairs and the National Tourist Board at Country Lodge Hotel in Freetown. Minister of Tourism and Cultural Affairs, Dr. Memunatu Pratt, in her address said the launch of the Budapest Bamako Freetown Rally 2022 is another historic event for Sierra Leone going forward. She said a lot of positives are visible in Sierra Leone, especially in the tourism sector, and attribute the gains to the political will of His Excellency the President. Next, ladies and gentlemen, the Ministry of Information and Communications has engaged Women's Forum Network on the cybercrime legislation. The Minister of Information and Communications, Mohamed Rahman Suare, re-echoed President Bio's commitment to promoting the affairs of women in the country and highlighted the actions taken so far with regards to protecting women against gender-based violence. He stressed the importance of the cybersecurity and crime legislation, saying it is geared towards protecting the country from cyber attacks and critical national information infrastructure, whilst also preserving citizens' human rights and privacy. Those are our intros before we get to the main business of the day. May I at this point recognize the presence of Mr. Mohamed Masakoy, who is the Director General of the National Civil Registration Authority, on whose shoulders rest a lot. And I see I was in Parliament, he was also in Parliament, and I also saw a member of Parliament talking about perhaps the need to extend the civil registration time frame. But I'm not competent to speak to those issues. All I have to do is to welcome him and to say thank you, because this is such an epoch-making innovation, and I'm sure it is a critical step towards ensuring that Sierra Leoneans have a digital biodata identity, and I'm sure it's an important international benchmark for all of us. At this point, ladies and gentlemen, may I give the floor to the chair of the National COVID-19 Emergency Response Center, Honorable Sheku Bangura, to give us strategic and other critical highlights within the domain of the COVID-19 response. And I'm sure that would be followed by a presentation by Dr. Tom Sise, the Program Manager for Child Health, and EPI, and also the pillar lead for vaccination in the COVID-19 response. First, the floor, sir. Chair.
Thank you very much, Honorable Minister, Deputy Minister of Information, who also doubles as the spokesperson for NACOVAC and head of NACOVAC Strategic Communications. I want to take the opportunity to just update on the status of COVID-19 in Sierra Leone, just to assure the public that we do monitor developments in the sub-region, that is the Mano River Union. And what we have is that Sierra Leone on the whole has actually retained essential health responses and kept case level very low, where the CDC US has rated us as a low-risk case for COVID-19. We are monitoring our neighbor in Liberia, is still assessed by CDC US as level 4. And we are monitoring globally the way we are rated in the last 28 days. COVID-19 rate per 1,000 population. Sierra Leone currently ranks at 0.1 per 1,000 population COVID rate, deemed a very low case globally. We have gone through 2 waves of COVID attack in Sierra Leone. First wave that started way back in March ending 2020, and around June, and then the second wave that actually emanated just around October, I would say around February rather, and then ended up just around March-ish, March this year. So that's what we've been through. However, there are new developments that are happening globally that speaks to huge risk that we see. These developments are happening in Asia, where we are seeing different strains emerging, and they are virulent, and they are actually ravaging havoc on their health system, but also on lives of people. So we here are clearly watching very closely and monitoring those developments, and we've been tracking data nationally, particularly from people traveling from Asia into Sierra Leone. Particularly in the last 6 weeks ended May 6th, we try to track generally what the positive cases had been, and we track people traveling particularly from India, and try to see exactly what risk they present in terms of positive cases. For that period, about 263 passengers traveled from India into Sierra Leone. We tested all of them. 258 of them tested negative. We got, within that period, 5 positive cases from India. And then we have been tracking also the Indian community in Sierra Leone, and we have had 16 positive cases amongst them. Among the 5 that were positive, 2 were evacuated from the country. We are not picking on India, but it's just to give you our alertness in the response around how we are tracking cases from across the world. But where there are cases of virulent strains or rapid increase in cases or high increase in death rates, we are paying critical surveillance attention to those countries or people traveling from those places. We are chasing the virus. Now, out of the 96 that we have had in that period, what we gleaned from it is largely a community spread that we face within the Western area. We've seen out of the 96, 35 positive from within communities, and about 36 positive from people who are traveling out of Sierra Leone to go out. So that's clearly a community spread that we have. We have people, 15 of them, of those positive cases are in our facilities, our isolation facilities, and then 10 of them had been people who are arriving into the country. I thought I should lay this more strategically and just tell you that from the EP data, what we see more generally is a decrease in new cases, but also bed occupancy. But in this space, what we have gleaned also is that when you have low case levels like this, it behoves that you become a little bit more critical on what is the cost of running the response itself. And so we've seen that it is important to deploy what we call a lean, efficient workforce that is agile enough to be able to respond quickly in case there are any unexpected spike in new cases of a different strain. And then we try to do what? Emphasize a shift to integrating and strengthening our long-term health and operational systems for epidemic emergencies, which I think is a mistake that we had during Ebola, and we don't want to repeat that. And then we try to ensure that our response continue to mitigate any negative impact on the economy and people's health and well-being. So that's the posture that we have gleaned from the response so far. So in terms of trying to right size, we have had a proposal presented to the Presidential Task Force, which is the highest level advisory body or oversight body for the response, to approve some serious reduction in staff numbers, about 49% across the response. So that's one information that I think the public must know. So we are right-sizing the response, meaning we will cut down on pillars where we know
that we can be more agile in the response, and we can repurpose those resources into pillars that we think we deem very important. For example, we are doing vaccinations now. So that's which were not there before in the response. So we are doing that kind of strategic thinking. So key consideration that we have as NACOVAC for the response are the following. One, that the second wave is really under control. You can see the numbers. And of course, Mr. Harold Thomas will be giving you today's EP update, and there you will see exactly how that has been happening. But we know that there is a risk of a third wave that we must pay attention to and must avert. And what we have seen is that the community spread is there, but our surveillance has been a little bit weak. In terms of, not weak in terms of not chasing the numbers, weak in terms of the scale of intervention or surging. Because until you're able to surge, you may not be able to glean very properly whether what you're dealing with is real or not real, right? So that's one. Second, we have laboratory testing under our watch. We have grown our capacity over the year from less than 100 per day to now we are doing above 1,000 PCR tests a day, having actually enhanced that capacity. We were doing RDT antibody at the airport, but it is becoming difficult to interpret that because we know that there's vaccination going on and people carry antibody with vaccination. So we see the need to try and recalibrate that testing strategy. Third, we have vaccination now in the country, and it is going on. What we have been doing is we are prioritizing high-risk groups, but what we've noticed is that the current rate of vaccination uptake is low, and there is need to ramp up that activity. So what is the strategy that NACOVAC has actually presented right to the task force on how we are positioning the response to ensure that we combat any third wave, we consolidate the gains that we have made, and ensure that we keep this country at low or zero rates of COVID-19 infection in Sierra Leone. First, we have talked about rebooting our surveillance strategy, our surveillance of case levels. Hence the need for us to focus on focus surveillance on countrywide in Sierra Leone, but also focus on persons who are traveling from countries with variants of concerns or high level of death rates or rapid increase or phenomenal increase in COVID-19 cases. Now we have therefore got approval and have actually updated our travel advisory, which currently is in force at the airport to focus on the virus where we know there are problems that we must avert not to enter Sierra Leone. Second, this next point in the strategy is to keep our case management agile. And what I mean by this is that we keep the key infrastructure lean, but robust enough to react very rapidly to any expansion in cases. So we'll ensure that all district headquarters have got an appropriate facility to respond to the virus. And then we maintain some huge regional centers and invest in them so that at least we build a capability in case there is any ramp up in case. We have an example of a facility at Port Loko, and I'll speak to that later. Third, we want to ramp up vaccination. We have a goal, and Dr. Tom will speak a little bit deeper on that. We have a goal of vaccinating a sizable population in the country, about 58. It's even ambitious. We're ambitious enough to get it to 70% of this country population. That's what we want to vaccinate. And then we ensure that we get access to vaccines to be able to do that. Currently, we are having support from COVAX. We will speak to that, but there are gaps, and we are thinking about how to ensure that we ramp up skill. Now, because of the different strains that are coming from other countries, we've seen the need to sustain something that they call genomic sequencing, meaning a scientific methodology in the lab to ensure that you are able to determine whether this country will have a different strain that is in our country that will ravage lives should it enter here. So any virus, specimen that are taken, the lab is positioning itself to ensure that we do that. We have 3 key labs in the country, 34, Kenema Lab, and the lab at Joy.
that have got capabilities for this. So we are looking into doing that. Currently, we are also working regionally and internationally, both with the US and Ghana, to do that while we build our capacity locally. So points of action that you must be watching going forward. We are implementing the travel advisory, so we are tracking people traveling from certain countries, critical countries. We are chasing the virus. If it's an area where you have terrible strains, but also increasing death rates and rising number of COVID, we'll track you and you'll be quarantined when you come for 7 days, tested on day 1 and tested on day 7. If you're fine, we'll allow you to integrate into our community. So that's what we're doing, but we still continue to test right at entry, even when and we require you to travel with a negative test. But when you travel, we know there is risk, so when you enter, you are tested right at point of entry, and we'll follow through on that. Another issue you should be watching for, we are right-sizing NACOVAC and ICOVAC response. That is an implementation that we need to do so that at least we keep the response fiscally sustainable. Third, we are trying to improve our testing strategy, moving to what they call antigen test. The scientists are here. They may speak to you about what that means. And then we'll try to redeploy resources to strengthen our system through e-surveillance tools to make our surveillance agile, testing facilities as Lunge so that people who are traveling have a better experience of not being too stressed and have what I would call a health condition area to avert any form of infection. Spend or put resources into building response capability in infectious disease facilities like the one we had, 100-bed that we have at Port Loko. And then we're trying to look at improving Gendema, the entry points to Liberia and Guinea at Malamuya, but also improving on our molecular lab capabilities. Now, the last thing that I think is important for the public, the critical aspect of this response has always been accountability, legitimacy, accountability, and transparency. The public needs to know how much the government has spent in the last 1 year on COVID response. I used to give this, and I think it is important that the public knows how far we have come and what are the things that have been spent on what we spent on and the kind of resources that we too have mobilized within the response. So let me give you some highlights. Total amount of resources that the government of Sierra Leone has actually invested into saving lives and saving lives particularly. That's the health aspect of the response. It's about 503 billion leones, meaning $60.3 million. That's what we have expended to protect lives of people in this country. What have we spent those money on? 7.4% of that has gone into behavioral change. That means communicating risk, social mobilization, and public information around COVID, so that these people change their behavior and imbibe the good etiquettes around COVID-19. Case management, ensuring that our hospitals have oxygen, adequate medical supplies, they have PPEs, they have soap, what they call liquid soap, and then you have alcohol rub in hospital in quantities across this country, not only in COVID facilities. That's how we are strengthening system. There we have spent 18% of the resources, which is about 90 billion. On the first one, 7.4%, it's about 37 billion that we've spent. On the operations of COVID itself, ensuring that all the NACOVAC and DICOVAC architecture are effectively funded and that they'll be able to carry out their response appropriately, procure vehicles, pay allowances, risk allowances to personnel. We have spent 44%. It's a big shift. When we started, we were setting up the architecture, we were spending close to about 57%. We redirected the resources into the science itself. So now we are spending less on operation. The response has stabilized, less on operations. We're spending more on the science now. So you see how the numbers are shifting. Isolation, we spent about 29.1 billion there, which is 5.8%, and it's reasonable because the case levels have been coming down. We've spent on surveillance about 29.6 billion, and that's about 10.9% of the response on surveillance. Testing, we used to have donations. Now the country is buying PCR tests. We bought antibody tests, and now we're going to be procuring antigen tests. Out of that, we've spent about 55 billion on testing. That's about 10.9% of the response. And then we have started vaccinating. So vaccination is being captured. Currently, we've spent about 1.5 billion, and all of this information I'm giving you as at the end of March 31, 2021. Okay, and these accounts are unaudited yet. Audit Sierra Leone, we're coming to look at our books and ensure that we've done proper use for these resources. So that's basically what it is, but there's an important information that I think the public needs to know. In COVID, we do test and people pay for test. They pay for test at the airport when they are traveling out or when they are coming in. So what we have been doing is that money we have collected close to, we have not close, precise. Okay, at the end of March 31, we precisely collected 53.6 billion leones. That's what have been generated, 10% on average of the total money expended by government into the response. And then we do get people to pay fines if they violate some of the COVID regulations. Out of that, we'll be able to mobilize 1.2 billion from that. So total of 54.9 billion is being mobilized from within the response activity, and this money is sitting at escrow. That means it's in a bank, and we have opened a special account at the Bank of Sierra Leone. We transfer all the transit monies to terminate at the Bank of Sierra Leone. The government will decide through His Excellency how to deploy this money, whether to re-put it back into the response or invest in critical health infrastructure. I guess his heart is very close, maybe, into something that he pronounced to build a diagnostic lab for this country. So we'll join whatever resources have been provided by ACC. We'll put this money in there to build a diagnostic lab that can diagnose any major illnesses in the country. That's one way that the thinking is coming. So let me stop there, and I'll be open to any questions. I have with me the team, Professor Sarr, who is the technical head for the health response. He's a professor and the vice chancellor of the University of Sierra Leone. Group Captain Kumba is out there. He's in charge of operations. Dr. Tom Sisse is in charge of the vaccination in the country. You have our Thomas. She's a communication lead for RISCOM. You have the Deputy Minister, who's the spokesperson. We are all here to be able to provide answers to any questions you may have. Thank you very much.
Thank you very much, Chair, for laying out the strategic highlights of the response. And I think it's important that we note that the response would have its strategies adapting to emerging trends relating to the pandemic. So one of the things he noted had to do with the emerging variants. So the first thing we have to note is that when we had this overwhelming situation in India, for example, we learned the last time the United Nations Secretary General Antonio Guterres described that situation as beyond heartbreaking. We saw the evidence on television when we watched major channels, whether it's CNN or Sky News or Al Jazeera, or even in the Indian news channels. You actually saw what was happening in India, and we were deeply overwhelmed. That's how Antonio Guterres described the situation in India. The exponential rise in cases, and this is not just India. When we had the same thing in South Asia or Southeast Asia, I listened to what UNICEF was saying. UNICEF said if major action was not taken, what was happening in Southeast Asia had the potential to reverse all the gains that we have made in addressing the pandemic. As a responsible country, as a government, and as a response, it was also important for us to look at our strategies and make sure that our strategies do adapt to the emerging trends. And so one of the things the chair has noted is laboratory, for example, making sure that when we have incoming passengers, whether or not they are coming from any country of concern, we make sure that our laboratory system is up to the task. We make sure that our surveillance, we do robust screening, and in doing this, we have always relied on what the experts have been telling us. So somebody like Professor Sarr, who is the technical coordinator, people like that, the experts will guide us. Let's, for example, look at the exponential rise in cases. Let's look at any country, for example, that is recording 100 or more cases per 100,000 population. Let's look at countries, for example, recording 50% or more, and you see sudden rise in cases. Let's look at countries with the emerging variants of concern. And you have several variants. You look at the Brazilian variant, for example. You want to look at the South African variant. You want to look at the Indian variant. So we have to look at the broad spectrum of countries, look at what is happening there. We make sure that we heighten our surveillance, we monitor and have instructive data on what is happening with respect to the pandemic all over the world, and make sure that within our response configuration, we're in a position to take the relevant and appropriate action. And what we've had from the chair is very comforting. So when people talk about Sierra Leone, the risk is very low. It's because of the actions that we are taking. We have the gravitas to take extraordinary actions as and when they are deemed desirable and necessary under the circumstances. Can we have a brief update from Harold Thomas? After that, I'll give the floor to Dr. Tom Sise to talk to us about vaccination, and then we can move over to the National Civil Registration Authority. Harold.
Thank you very much, Mr. Minister. This is the 60th week of the outbreak in Sierra Leone, and I will give the EPI update for yesterday, since today's update is embargoed for 3 p.m. Cumulative cases 4,115, total deaths 79, active cases 4, cumulative recoveries 3,106, number currently in quarantine 55, number discharged from quarantine 14,864. As I told you, this is the 60th week of the outbreak in Sierra Leone, and the number of tests conducted in the week 19 were 3,025 and decreased by 5% compared to last week, which is week 18. Positivity rate for the week decreased from 0.8% to 0.7%. Average number of daily tests in the last 7 days is 453. Cumulative number of COVID tests conducted is 163,416, which gives us 21.32 tests per 1,000 of the population of Sierra Leone. Average positivity rates for all samples tested for COVID-19 is 2.5%, and the average positivity rate for the last 7 days, counting backwards from yesterday, is 0.7%. 2 out of the 16 districts have reported cases in the last 7 days, meaning 14 districts have not reported any case for the last 7 days. The national attack rate stands at 53.7% per 100,000 of the population of Sierra Leone. And the district with the highest attack rate still remains the western area urban, followed by the western area rural, Bond, Bo, Kenema, and Pukloko in that sequence. And 100% of contacts currently under follow-up were reached by our contact tracers in the last 7 days. And 100% of persons in quarantine are under self-quarantine, meaning we do not have any organizational quarantine so far in the country or any government quarantine facility operating. Thank you very much.
For those of us coming late, Dr. Tom Sise is the Program Manager for Child Health and EPI, and also the Pillar Lead for Vaccination in the Response. The floor is yours.
Thank you, Honorable Minister. Yeah, thank you very much, Honorable Ministers. Okay. Honorable Ministers, distinguished journalists, I think we've heard from previous speakers that we are now in a transition, moving from surveillance, case management, going towards prevention, which is through vaccination. And of course, you're all aware of the fact that we had a very successful launch of the vaccination exercise in this country, where no less a person than His Excellency the President, set a very good example and started the ball rolling and ensuring that he was vaccinated. And then, of course, on the 22nd, that happened on the 15th of March, and on the 22nd of March, nationwide vaccination started. We established 2 vaccination sites in most of the districts, with the exception of the Western Urban, where we had 4 sites established, and we also had mobile teams. So far as I speak, from yesterday's data, 63,446 Sierra Leoneans have received the first dose of COVID-19 vaccination, while 7,785 have received their second dose. In terms of the distribution of vaccinees, of course, the highest number is in the Western Urban, which has about 10,000 people. 10,123 have received first dose, and 1,843 have received second dose. Kenema district is also not far behind. They're doing extremely well. 9,801 people have received first dose, and 852 have received second dose. And then Bo district, 5,839 first dose, 698 second dose. So these are the top, and then of course Kailang is the next district, 5,744 first dose and 828 second dose. See, these are the districts that are leading the way. Of course, we were expecting much more vaccinations in the Western Urban, considering the fact that it's the epicenter of the transmission so far. Most of the cases we are having in the country are actually coming from the Western Urban districts. The target groups, I believe we should be aware now, are those people over 40 years of age, and of course, all healthcare workers. Priority is given to people who are more elderly and people with comorbidities, but as long as you are above 40 years of age, you are eligible to be vaccinated. We are using 2 vaccines that are available with us now, the Sinopharm vaccine and the AstraZeneca vaccine. Both of these vaccines have received WHO, they are registered under what is called emergency use listing. So they have been certified as of good quality to be used. So far, we have not recorded any major adverse events. We have 30 that have been documented. I'm not saying that some people have mild complaints that they may not report on. So we may have some other mild conditions that were not officially reported. But those that have been officially reported so far are just 30, and all of them are doing fine. They have been, they are not. There's no major cause for concern. So, of course, some of the things we would want to also emphasize is the fact that every vaccinee is issued a vaccination card, and we want to emphasize that these cards should be well. We need to take very good care of these cards. I will advise all of us to laminate them, to move around with them, so that we can be able to show evidence of our vaccination status, because it gives comfort, wherever we are going. So that is something that we want to advise, that we all try to move around with our vaccination cards. It's also very important because the doses we have are limited, right? We had a total of 336,000 doses. So far, we have utilized 101,000 doses. So we do not have an endless number of doses. And just like previous speakers are saying, the viruses are circulating, and they can become more virulent. At one point, India was stable. Before you know it, it was on fire with COVID-19 infection. So I'll implore Sierra Leoneans, please, let's make sure that we try to come out and get the limited doses, so that we don't have a situation where we'll be looking out for those seats and they are not available. So, of course, going forward, we are planning with the support of NACOVAC to scale up vaccination. We want to ensure that we have more mobile teams supported so that at the end of
the Civil Registration Act of 2016 established the National Civil Registration Authority, and the eminent head of that authority is here with us to help us to be privy to happenings in that institution. We are all witnessing the dramatic change in the civil registration landscape in Sierra Leone, and it's now my pleasure to give the floor to Mohamed Massakoy, the Director General of the authority, to give us critical highlights of happenings. Mr. Massakoy, the floor is yours.
Thank you very much, Honorable Minister, colleagues in government and the media. Good afternoon. We are pleased to be here to update the public on this very important national exercise of confirming the personal information of those who have registered with the NCRA since 2017 to date, and to give people the opportunity that have not registered with us to do so. The reason being that we should be able as a government to account for every resident in this country, whether you are a Sierra Leonean or a foreign resident. And therefore, government took this exercise very seriously and gave its approval for us to undertake it. Of course, preparations for this exercise commenced in 2019, and we were to start it in March last year. I remember last year, February, we were here and we used the same medium to announce to the public that we are going to start the exercise in March 2020 until COVID broke out. And unavoidably, we had to postpone it. And even before the commencement of this exercise now, we sought advice from NACOVAC following government approval for us to proceed with the exercise. We see we can proceed with it now. And we set the date for the exercise to commence this May 6th. And before that, we had several engagements with critical stakeholders, beginning with those institutions, organizations that have critical need for population data. We are managing data on the population of this country and the events that characterize each and every one of us, from birth to death. And in those engagements, we made sure we engage the MDAs, beginning with the Ministry of Health, Statistics Sierra Leone, the Electoral Commission, the local councils, the traditional authorities, the tribal authorities in Western area here, etc., for us to agree, and they will present it to them what the exercise will contain and how we wanted to go about it. And in those engagements, a sector of those stakeholders, the political parties, through the Political Parties Registration Commission, requested made an appeal for government to consider increasing the number of centers that we had identified for use as centers for the confirmation and registration. We had first decided to say we'll have 1,645 centers, and we'll do the exercise for 8 days, taking into consideration the demonstration we did with all stakeholders to see in maximum 2-3 minutes. If you are honest with your data, you don't want to play any game with it, you present the documents that we ask for, information we want. In few minutes, 2-3 minutes maximum, you should be confirmed. And then so they made an appeal for government to consider increasing the number of centers as well as adding a number of days. Government, being magnanimous, looked into it. We said we'll have 2,000 centers across the country, and from 8 days to 10 days. And every other stakeholder that participated in the engagement, they're all pleased with that. And then we engaged them. We said we are going into action. The exercise that we have started now, that we started on the 6th of May, had a number of activities before it commenced. We recruited 1,200 staff on contract for Western area, because this is an exercise that will provide employment on short term for over 10,000 Sierra Leoneans that are employable from various categories, ranging from degree holders to even WASC holders. And so we did the recruitment, and we trained them to be able to sharpen their skills in managing, operating the equipment and the procedures. So these staff, they are deployed and materials, equipment distributed. Shortly before then, in our engagements, we had agreed. Some organizations expressed interest to observe the process. We want to make it transparent and accountable, where tomorrow, when there is need for it for any use, no one questions anything that may have been done in any other way other than transparent manner. And we declared that, we announced a number of institutions, organizations applied for accreditation. Those ones include the National Elections Watch, the Center for Accountability and Rule of Law, Coalition for Civil Society and Human Rights, Praises Watch Sierra Leone, Sierra Leone Teachers Union, Conscience International Sierra Leone, Sierra Leone Information and Communication Technology Association, National Watch for Examination Mass Practice, United States Embassy. All of these agencies that met the criteria we put and agreed with the stakeholders were accredited to observe the process. And the process commenced on the 6th of May 2021, intended to last for 10 days. That will have been on the 15th of May. We said the exercise will do it by region. We have started with the Western area, and when we end here, the next region will be the North. After the North, we will go to the South to the Northwest, and the Eastern region. Now, we have, for the Western area, we have 216 centers covering urban and rural. In addition to those 216 centers, we put together over 30 roaming teams that will be deployed to attend to communities, particularly those that are sick and are admitted in hospitals, because we engage the Ministry of Health and sought their support for also access the sick in the hospitals. We also engaged the Sierra Leone Correctional Service, and they cooperated with us to access the inmates there. We also engaged the Health Ministry for the mental homes, and some institutions and offices that express interest will also meet them, given their tight schedules. So that is why we deployed roving teams that have been working alongside with the static teams in the centers there. The exercise started. You will recall that the first 2-3 days we had some challenges. People cooperated with the process. What we found out was that there were some people took megaphones and were in communities announcing to their people. But no, this was another form of census or some other thing, and they didn't want people to participate. And then, so people were a little hesitant, but we are swift to let people understand. Yes, civil registration is part of Statistics Sierra Leone. We are collaborating, but this is not census. Statistics Sierra Leone will talk to you when it's time for census. And this one is civil registration, where we are having your information for your personal identity. And thank God we had the cooperation of key stakeholders that made endorsement messages, beginning with the Sierra Leone Road Safety Authority, for instance, that advise potential drivers or people that will want to have driving licenses or register their vehicles to make sure they have their national identification number for their identity to be vetted before your vehicle is registered or you are given a driving license. We had similar messages from NRA for those wanting to register their businesses. Similar message for NACIT for anyone that will want to join the NACIT scheme, and every other one, including the immigration, those wanting passports, and it went across key stakeholders, key agencies that will provide services to the country's population. Those endorsement messages were climaxed by His Excellency the President, who also, he did not only participate in the process as a citizen of this country, but made a pronouncement, an endorsement message encouraging every one of us to participate in the process. Identity is important. You have a responsibility to make yourself available for government to know that you exist. You never know the importance of identity until you are caught in a situation where you need to be identified, and then you will have a problem. That will be the time people will begin to blame government and those ones. That is why government has said, reach out to people, give this opportunity to the people of Sierra Leone, come out, cooperate with the process, participate in the process, confirm your information, as well as register if you have not done so. In the course of this exercise, we are able, because we saw after the 3-4 days and our robust response to counter those nefarious messages on some people in the communities that it was something else, and we successfully managed that. We brought on board the National Commission for Democracy. We'll be working very well, and thanks to you, the media, for also supporting the process, the traditional media. You did very well to help educate the people on what we are doing, the importance of it. We reassigned over 100 to 300 permanent staff of NCIA from across the district to come to Freetown and Western area and augment the 1,200 contract staff that we had engaged. And then we'll put them also on those roaming teams to go to offices, institutions, particularly those who have requested for us to support them. And important also is that we sought the cooperation of the Ministry of Foreign Affairs and International Cooperation. Civil registration accounts for everyone, citizens and non-citizens. We have a data of about 5.3 million people in this country that we have registered. Of that 5.3 million, we have 10,122 foreign residents. We cannot have just citizens catered for. We requested the Foreign Ministry to help us access the foreign residents in this country through their foreign missions and embassies. And happily, the Foreign Affairs, being very supportive, did exactly that. They requested foreign embassies and missions to facilitate our access to their people. And we have been doing that. We have had the cooperation of all of them, the UN agencies, their families, and some other international organizations here, except for the Chinese that have not yet turned up for their confirmation or registration. You will agree with me that, of course, these ones cannot go, an exercise of this nature cannot go without maybe what will become as challenges. Of course, I mentioned one in my intro, but the attitude of people misinforming others was a little bit of a challenge for us. But thank God we were able to address that. And in all of those centers, we have had a very strong cooperation from the Australian police to maintain decorum and order, so that people will follow procedures. Of course, we have had instances that people attempt to bypass procedures. But thank God, with the presence of the Australian police, those ones have been contained. We have also had challenges of managing children alongside adults. We are now in discussion with the Ministry of Basic and Secondary Education to see which provision we can make for school-going children and non-school-going children that following the end of the exercise, and how we can accommodate them. Of course, when we started the exercise on the 6th, it ought to have ended on the 15th, but given the overwhelming public turnout, we said to ourselves, we cannot end this process without giving people additional opportunity. And so, with support from government, this is solely an exercise that is fully supported by government, like I announced last year, February, when I had the opportunity to address this body. And then we extended the exercise for another 7 days, 1 week, that will end on the 22nd, Saturday, for Western area. Mind you, civil registration, of course, is a continuous process. As you continue to give birth, as people continue to die, as you continue to marry or divorce or adopt, etc., etc., we have the responsibility to manage those events by law, and you also have the duty to report those events for them to be captured. It's important for your very self. And with all of this, when it ends in Freetown in Western area on the 22nd here, the next region will be the Northern region, where we'll require staff of about 2,334 to manage 449 centers. In the north also, Haven Lands, the lessons we've had here, we'll deploy staff of NCRA from the district. We'll all move to the north, like we have done for Western area. That makes it a little okay, so that we can work there in an efficient manner. And of course, I mentioned that we are in discussion now with the Ministry of Education for also support the children. And then we'll continue to respond or to attend to institutions, organizations that request us to attend to them in their offices or some facilities that they would need. We have done that for several other institutions. We have Parliament today. We have done that with the judiciary. We did that for the law bar association. We have a schedule for the medical and dental association tomorrow, I think. And we are doing that with so many other foreign missions here. I think we are in discussion for the journalists as well. So every sector that requests us, we want to make sure that we are able to capture everyone. And then you have the responsibility to present yourself to cooperate to the process. The advantages are too many, but you wouldn't know until you stand to risk it, because you are not identified. And therefore, you have the responsibility to present yourself to do so. We have had instances where people, out of negligence or some other reason, they say, go and present yourself, go and have your identity in place, refuse. And when they now have opportunity to go, for instance, overseas for some study, and that is requested, and then they put unnecessary pressure on us for either birth certificate, etc., etc. But you don't have the time. Go out, cooperate with the process, present yourself that you are there, you are either a Sierra Leonean or a foreign resident, that you have to be registered or accounted for. So generally, the exercise will continue, and from here we'll be in the north, beginning the 20th of June, of the 1st of June to the 10th of June. will be in the West. Thank God. I'm also happy to announce that we have had very strong cooperation from the RSLAF, who have consented to support us with logistics, with vehicles to move some equipment and materials in very difficult terrains that normal vehicles may find it difficult. So that's how we have been collaborating so far. We're working well with the Office of National Security, SLP, the other security agencies, and every other party. This is what we have been doing so far that we wish to continue to do. But we want to say, please cooperate with the process because it is about your identity. Personal identity is very much important. Thank you very much.
Thank you. Thank you very much, Mr. Masakoi. And I'm sure as Sierra Leoneans, you want to.
I just wanted to add that we brought a team here